السلام عليكم ورحمة الله وبركاته. موضوعنا xerostomia, attitudes and experience among the dentists about the management of xerostomia in patients wearing complete denture. Xerostomia refers to a subjective sensation of dry mouth. It is a common complaint among the elderly people. Approximately 30% of the people aged 65 years and beyond suffer from xerostomia. The elderly are at risk not because of decreased salivary secretion but because of chemical change in saliva. A study by John Wiley and Sons reveals that denture wearers are more susceptible to dry mouth, which lead to oral infection. Absence of saliva in the interface of denture and mucosa can cause inflammation and ulceration of the oral cavity because of lack of lubrication and denture instability. Lack of denture stability and retention can cause social impairment to a complete denture patient. Xerostomia can have a sufficient negative impact on the patient's health and overall quality of life. Promote diagnosis and management of xerostomia in complete denture patients will relieve the psychological stress and anxiety of these patients. The purpose of this article to assess the knowledge, attitude, and management of xerostomia in complete denture patients among the dentists. الcauses of xerostomia. الaging هو الcommon risk factor for xerostomia in patients wearing complete denture. Amount of betaline and mucin in saliva increase. Saliva become thick and viscous. Use of medication and age are sufficient as risk factors. other causes اللي هي autoimmune disease like Sjogren syndrome, radiation therapy, dehydration, chronic mouth breathing, systemic illness اللي هي diabetes mellitus, nephritis and thyroid dysfunction. common causes of dry mouth اللي هي dehydrations, recreational drug, drinking and smoking, snoring and sleep apnea, vitamin deficiency, particularly vitamin A and B, healthy conditions like diabetes, leukemia, autoimmune disease, HIV, AIDS, clicking noise in your jaw, mouth breathing due to the nasal congestion or problems with nasal potency. dry mouth symptoms اللي هي bad breath, tooth decays, loose dentures, difficulty swallowing with troubling in the speaking. chronic mouth breathing. نبين لي سبب الxerostomia اللي هي tobacco use, dehydrations, nerve damage, signs of underlying disease or condition, Sjogren, Alzheimer's disease, anemia, diabetes, crystal fibrosis, hypertension, Parkinson's disease, Strickle and MABS, a side effect of certain medications, والHIV والAIDS. A diagnosis of xerostomia. The diagnosis of xerostomia can be made from patient history, examinations of the oral cavity, and by various investigative procedures like cyanometry. Patients wearing complete denture and suffering from xerostomia often complain of extreme discomfort and pain in wearing denture. They may be also complain about difficulty in normal function, eating, speaking, swallowing. The other symptoms include cracking in the corner of the mouth, burning sensation of the tongue and alteration of the taste. Failure of denture retention and denture instability are also worrying problem in these patients. Management and treatment of xerostomia. Several treatment strategies for management of xerostomia have been proposed in the past years, and they all aim to reduce patient symptoms and or increase salivary flow. Easy remedies are proper hydration, increase in humidity at night time, avoidance of irritating dentifrice and candies, hard food, and use of sugar-free chewing gum, candy, Medication include mucosal application, saliva substitute, and saliva stimulation. Systemic stylo, gas, intraoral topical agent, change in medications, and other. Thank you for listening to me and compliance with my friend Shahab.
Systemic xylogos used for management and treatment of xerostomia include two medications, pilocarpine and cevimeline, are systemic, use food and drug administration, approved xylogos form treatment of dry mouth. These effects depend on the presence of vaginal granular tissue. Oral pilocarpine is parasympathetic. Oral pilocarpine and cevimeline are used for stimulation of salivary gland flow. الديفرنت بينهم راح يكون بالدوزج. الأورال pilocarpine administered at dose of 5 mg 3 times a day for at least 3 months, and cevimeline administered at dose of 30 mg 3 times a day for at least 3 months. Intraoral topical agent. An intraoral topical agent most recommended treatment for the management of xerostomia. These include chewing gum with saliva stimulants. Topical xylogos spray containing 1% malic acid has recently shown efficiency in the management of patients with xerostomia with the antidepressant or antihypersensitive. Induce dry mouth 30 however. Change in medication. إذا كان البيشنت ياخذ أدوية decrease salivary gland flow راح تكون treatment of xerostomia by decreasing the dosage of medication or potentially replacing the medication with the less xerogenic drugs. Others. من الطرق الأخرى for management and treatment of xerostomia, intraoral electrostimulation has seen tests on increasing salivary flow. Medication of complete danger. Salivary surgery must be included in the processes, either by modification the palatal region of maxillary denture or by creating chamber in the bulky area of denture. Case reports. Male patient reported to the Department of Prosthodontic, 67 years old, with a chief complaint of difficulty in mastication due to dryness of mouth and absence of teeth. Medical history that the patient had undergone RT 2 years back for differentiated squamous cell carcinoma involving posterior 1/3 of lateral border of the tongue, extraoral examination, lower facial high and unsupported enamel, intraoral examination, maxillary and mandibular edentulous residual ridge and decreased salivary flow. الفيجر راح توضح لنا هالشي من خلال الفيجر. راح تكون التريتمنت بلان لهذا البيشنت. A treatment plan included either fabrication of implant, supported or conventional upper and lower complete denture with the external application of salivary substitute in the oral cavity, or fabrication of lower complete denture with the artificial saliva reservoir in it and upper conventional complete denture. It was discussed with the patients was obtained for agreed treatments, which include rehabilitation of upper arch with the conventional complete denture and reservoir denture in the lower arch.